Hi, I'm Jill. Today I'm going to be guiding you through performing CPR on dogs and cats. You've already gone through part of the training module, but today we're going to be practicing the actual movements of CPR so that you can feel more confident if you need to use them during an emergency. The first thing you should do is set up your practice space so that you have a comfortable amount of room to work with your mannequins. So today you should have 3 different mannequins. You should have your large dog mannequin here, your small cat mannequin, as you can see here, and then over here you should have your mannequin that simulates a square-bodied dog. You can use a yoga mat like I have here to make things a little bit more comfortable for yourself if you're kneeling. You can also perform CPR on a low table if that's your preference. So this is what you should do now. Go set up your work area and I'll see you when you're ready. Are you all set up now? Great, so let's get started. So in the module so far, you've learned how the heart and lungs work together to oxygenate blood and why we do CPR. So let's stop for a quick review. So one of the first steps of CPR is to make sure that it's actually required, which is what we covered in modules 4 and 5. So assuming that a dog or cat is unconscious, is not breathing, or has no pulse, the next thing we're going to do is position them in the proper position for their body type. So the next thing we're going to do is position our dog in the proper position. So we know that we're going to put them on their right side with their legs facing away from us. So this is their right side, as you can see. So I'm going to turn this dog like so and lie him down so that his legs are facing away from me. Next, we need to position ourselves. It's very important to make sure that our knees, our legs are actually scooted up nice and close to the back of the dog. This is to ensure that we're not going to be leaning back too far away from the dog so that our compressions are nice and effective. The other thing that we're going to do is to make sure that we're going to do our compressions with our whole body rather than just with our arms. So if I'm going to do compressions just with arms, I could lean back like this and just do it this way. But unfortunately, this is not going to be very effective. You're not going to be able to compress the heart correctly. Not only that, we're going to get very fatigued over time and we're not going to be able to continue doing CPR for a long period of time. So in this case, what we need to do is we need to get up nice and high and we're going to place our hands onto the dog's chest, approximately where we're going to be doing compressions. Put our hands over each other like this and lock our elbows. So again, we're not going to be doing compressions this way. We're going to lock our elbows and we're going to use our whole body to do compressions like this. Since we're trying to move the blood through the body the same way that the heart would, we have to compress the heart to the extent that it's going to pump blood. If you think back to the module so far, you'll remember that we're supposed to compress the chest to 1/2 to 1/3 the depth of the chest. So this is what I'm going to demonstrate for you now. So we need to landmark the area that we're going to actually start doing chest compressions. What we need to do is to landmark the highest point of the chest, which is in the center of the chest. Now the leg is here and the elbow is located right here. So it's just behind the elbow, back, and in the center of the chest. So this is the area that we're going to want to compress. So I'm going to place my hands one over the other, lock my elbows, making sure that my shoulders are directly over top of my hands, and I'm going to do compressions with my whole body, like this. So you also remember from the lesson that we're supposed to do compressions at the rate of about 100 to 120 compressions per minute. This is actually at the rate of the song by the Bee Gees, Staying Alive. So if you sing that song to yourself, you'll have about 100 compressions per minute. So now we'll start to do a set of compressions mixed with artificial respiration breaths. Do you remember what the ratio of compressions to breaths is? That's right, it's 30 compressions to 2 artificial respiration breaths. For the respiration breaths, I'm going to demonstrate to you now how this is done. So we remember from the module that what we do is we're supposed to pull out the tongue the dog's tongue. We're going to close the mouth as best we can, put our hands around the mouth to stop the leakage of air, and then we're going to breathe into the nostrils and watch the chest rise, making sure that the chest is rising. You can actually kind of look as you're breathing in and see the chest rise and fall as well. So this is how this is done. So now we'll go through one complete 2-minute cycle of CPR and artificial respiration breaths. You can watch me do it this time, and then next you can join in. Landmark, hands over each other, lock the elbows, shoulders over top of hands, begin compressions. And 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. And there, we've completed a 2-minute cycle of CPR. You'll notice that I counted out loud. You don't have to if you can keep time in your head. That's okay. Either way is perfectly fine. So let's try this together. Get your large dog mannequin and get it set up into your practice area, and we'll get started. Okay, let's try this together. Landmark the area of compressions, the center of the chest at the highest point behind the elbow, hands over each other, lock the elbows, making sure your shoulders are over top of your hands, and we're going to start compressions with our whole body. Ready? 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Okay, now it's your turn. I'd like you to go through a complete 2-minute cycle of CPR, making sure that you give the 30-2 compressions to artificial respiration breath ratio. Wonderful, welcome back. You're getting good at this now. So my next task for you to do is I'd like you to go through 2 complete cycles of CPR of 2 minutes each. So that's 2 minutes of CPR of compressions with artificial respiration breaths, stopping at the end of the 2 minutes, checking for pulse, consciousness level, and whether the dog is breathing, and then continuing on with another cycle of 2 minutes of CPR, compressions, and artificial respiration breaths. Go ahead and do this now. Hi, welcome back. How did it feel to do CPR for that length of time? Did you find that it made you fatigued, a little bit tired? If so, that's okay. You can adjust your body position a little bit as you're going through and doing your compressions and artificial respiration breaths. So you've got a good start on your practice, but this is a skill you'll need to practice over the next week before you video conference with your instructor for your final test. So practice well, good luck, and thank you for joining me. Bye.